Hi guys, we'll discuss about the brachial plexus. So first of all, what is a brachial plexus? If anyone asks you what is a brachial plexus, what is your answer? So to answer this, we'll discuss about the brachial plexus now. So first of all, definition. The brachial plexus is the plexus of nerve. Plexus is the network of nerves formed by the anterior primary rami of spinal nerves C5, C6, C7, C8 and T1. So this is the network of nerves formed by the anterior primary rami. We'll discuss what is this primary rami to a diagram which was drawn below. So arising from this spinal nerves C5, C6, C7, C8 and T1, these spinal nerves unite to form a network of nerves which innervate the upper limb, so called brachial plexus, because brachium means the arm. So they pass through the axilla and they are innervate arm, forearm, right? So upper limb basically. So the name brachial plexus has been termed. So C5, C6, C7, C8 lower four cervical. T1 is the first thoracic spinal nerve arising from the segments of the spinal cord with occasional contributions from anteromedial of C4 and T2. With occasional contributions also will be there, which provides sensory and motor innervation of the upper limb. So these spinal nerves arising from the spinal cord, they provide sensory and motor innervation of the upper limb. So this is the brachial plexus, the network of nerves called as brachial plexus. So this will discuss through the diagram. See, you can see the brain, spinal cord. This is the central nervous system, right? So the spinal cord passes through the vertebral column, right? So this C1, C2, C4, C3, C4, C5, C6, C7 and T1, these are the vertebral column vertebrae. From the vertebrae, through the vertebrae, the spinal cord passes. So from the spinal cord, these spinal nerves arise, right? So C5 root of a spinal nerve, C5, C6, C7, C8 and T1 roots combine to form this network of nerves which passes through the axilla and which goes to arm and forearm. They innervate the total upper limb. So these network of nerves are called brachial plexus. See, as we have discussed in the definition, right? Anterior primary ramus. So will come from the basic, very basic. See, this is the transverse section of the spinal cord, right? This is the spinal cord. This is the vertebra, you think. So transverse section of the spinal cord along the vertebral column. So from the spinal cord, these spinal rootlets arises, right? So this is the dorsal root ganglion, and this is these two spinal rootlets arises, and they come out from these vertebral column and again divide into two. That is posterior ramus and the anterior primary ramus or anterior ramus. So this division, these anterior primary ramus is what forms the brachial plexus. These anterior primary ramus unite and this network of anterior primary ramus which forms brachial plexus which innervate the upper limb. You can see this. This is the spinal cord. See, from the spinal cord, this root C5 root, C6, C7, C8 and T1, this roots arises which eventually unites. They form this pattern. We'll discuss how this pattern is formed. We'll elaborate everything like what is root, what is trunks, what is division, cords and branches. For now, you just have an idea what is the brachial plexus. See, these roots arises and they unite and they go and they see they interchange and finally they go along the axilla and the arm and the forearm and they innervate the upper limb. So you at first you have a basic idea. See, as in the diagram we have seen occasional contributions from C4 and T2 as you have discussed here, right? Occasional contributions from C4 and T2. Like what it is means, brachial plexus is not same in all individuals. Different individuals may have different pattern of brachial plexus. Like what I can say is no two people have the same structures. I mean, some will be same, but not all the structures are same in every individual, right? So these brachial plexus also are not same. It may be different in different individuals. So based on that, we have two types, like prefixed brachial plexus and the post-fixed brachial plexus. The name itself tells prefixed, that is one segment above forming brachial plexus is the prefixed. One segment below, if it shifts, it is called post-fixed brachial plexus. So you can see prefixed, we have contribution from C4 also. In the diagram you can clearly witness here. C4 contribution is large in prefix. Pre means it jumped above one step. Post means it got down one step below. Same, simple as it is. C4, C5, C6, C7 and T1. So T2 is absent in the prefix. In the post-fixed brachial plexus, C4 is completely absent. That means it shifted downwards. That is C5, C6, C7, T1 and T2 contribution is large. So these two types of brachial plexus can be seen in any of the individuals. See the variation in formation of brachial plexus. The origin of brachial plexus may shift one segment either upward, that is prefixed, either downwards, that is postfixed. Same, see final. In the prefix, it may arise from here. So one step above, it has displaced, that is prefixed. If it comes to like this only, C5, and if the contribution is from C2, T2 also, one step below it displaced, so it is the post-fixed brachial plexus. Like that, you understand. So in order to understand the complete brachial plexus, the nerves, etc., first of all we should have a basic funda, right? Basic information about the nervous system. So we'll discuss. Nervous system divided into two types, CNS and PNS, that is central nervous system, peripheral nervous system. Central nervous system has brain and spinal cord. And what is peripheral nervous system? This is very important for us because the nerves arising, right? So the central nervous system comprises brain and spinal cord. The nerves that arises from this central nervous system is the peripheral nervous system, right? So from the brain arising nerves are called cranial nerves, and the nerves arising from the spinal cord are called spinal nerves. These nerves are called peripheral nervous system, peripheral nervous system. So the nerves arising from the central nervous system are called peripheral nervous system, that are nerves. So nerves, we have two types, cranial and spinal. 12 pairs of cranial nerves are there, 31 pairs of spinal nerves are there. So to remember this, we have O3T2 FVGVA. This is a mnemonic we'll study in further classes also. Just to have an idea, I'm discussing here. So olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. These are the 12 pairs of the cranial nerves. If we come to the spinal nerves, see, this is what we require. See, cervical plexus and brachial plexus. These two comprises cervical nerves. Touch your neck. From the neck, vital structures, neurovascular structures will have, right? So the neurovascular nerves that arises from the spinal cord segment in the neck are cervical plexus and the brachial plexus. So the brachial plexus is what is important. This is very important. So cervical plexus are the network of nerves, but the brachial plexus are the complex one. They innervate whole upper limb, right? So studying this is very important. So the cervical plexus and the brachial plexus together form the cervical nerves. Cervical at the neck. The location is at the neck, so cervical nerves, and the thoracic nerves. Thoracic cavity. Thoracic nerves, 12 pairs. Same, the spinal cord or origination of the spinal nerves from the spinal cord at the level of thoracic vertebra. And the lumbosacral plexus. Lumbosacral, sacrum and lumbar sacral vertebrae region. The spinal nerves arising from the lumbar region and the sacral region are the together form the lumbosacral plexus. Those are 10 pairs. And the coccygeal nerve, the 1 pair. So we'll discuss and we'll discuss about these nerves through a diagram. See here, this is the diagram which I have drawn. See, this is the anterior view. As you can see, brain and the spinal cord. This is the spinal cord. This is the central nervous system. The nerves arising from the. So you can see this is the neck, right? So C1, C2, C3, C4, C5, C6, C7. Cervical vertebra segments. That is spinal segments directly. So C1 arising, see, you can see the spinal nerves arising from C1, C2, C3, C4, C5, C6, C7, C8. So this, see, this C1, C2, C3 starting above the segments forms the cervical plexus. See, cervical plexus. So the definition, what definition of the brachial plexus tells us, like C4, C5, C6, C7, C8 and T1 and T2, that prefixed and post-fixed. So these roots, these spinal nerves form network of nerves. Those are called brachial plexus. Brachial plexus. See, they go through axilla, arm, and innervate forearm and total upper limb. So studying this plexus is very important clinically, because injury or compression to any one of the nerve or any injury to the nerve causes paralysis of the upper limbs. So studying this plexus clinical is very important. So that's why the weightage to the brachial plexus is very, very, very vast. So we have to study this plexus in detail. So these two, cervical and the brachial plexus, form the cervical nerves, that is 8 pairs. And see, this is the thoracic vertebra segment, right? Thoracic vertebral segment, the spinal cord. You can see the spinal nerves arising at the region of thorax. So these spinal nerves form the thoracic nerves. Those are 12 pairs. And see the lumbar region and the sacral region and coccyx. See L1, L2, L3, L4, right? Lumbar plexus. And S1, S2, S3, S4. The spinal nerves arising, which unite and go further and forms like sacral plexus, which innervate different structures. So lumbar plexus, sacral plexus, they together form lumbosacral plexus. So this is also very important. We'll study it in lower limb. So lumbosacral plexus, the lumbar nerves are 5 pairs and the sacral nerves are 5 pairs, together 10 pairs. So the coccygeal nerves 1 pair. See, 1 pair, chorda equina. So this is the network of nerves in the complete body. See the nerves arising in the brain, cranial nerves. These are the cranial nerves, and these whole are the spinal nerves. As you can understand clearly here, the complete nerve plexus, complete nerves of the body I have overviewed here. So you can further understand every topic about the nerves easily, right? So see, same. See the cervical, thoracic, lumbar, the arising spinal nerves. See, this is the vertebra, right? This is spinal cord. The spinal cord goes through the vertebra, right? So they have spinal rootlets, and they come out from this. They'll come out posterior ramus, anterior ramus. This is what forms the brachial plexus, right? Anterior ramus from the C4, C5, C6, C7, like C8, T1, T2. So they form brachial plexus, right? See, spinal rootlets, spinal cord, spinal rootlets, ganglion. See, this branches into posterior and anterior primary rami. So these together form, this unite and forms brachial plexus. See, understanding the basic things is very important, so that you can understand the further complex topics easily. See, spinal cord, spinal rootlets, dorsal root ganglion. Spinal rootlets come out from the vertebra and divide into two: posterior ramus, anterior primary ramus. Anterior ramus, also called as anterior ramus, you can see here. See, anterior ramus. These forms the brachial plexus, right? So C5, C6, C7, C8, and T1. These unite and further go extend to form brachial plexus. You're brushing up things. See the brachial plexus. You can see clearly brachial plexus. See, arising here, and they are passing here. They're going through the whole upper limb. This is anterior and this is posterior. So guys, you can see the brachial plexus. So we are stopping the lecture here only. So the components and about the roots, trunks, divisions, chords and branches we'll study in the next part. So this video gives you a view of brachial plexus and all the nerves in the body. It gives the view on all the nerves originating from the body, and it will make you understand the brachial plexus very well. What I can say is, it makes you understand brachial plexus very well, so that upcoming complex topics will become a piece of cake for you. So next part we'll discuss about components of brachial plexus. That is 5 components: roots, trunks, divisions, chords, and branches. So stay tuned. If you have any queries, if you have any doubts, if you have any suggestions, please do comment. I will try to implement. If you want any topics also, comment. If any changes need to be done in the teaching format, I can consider it. So feel free to comment and tell. Thank you. Stay tuned.